Assalamualaikum and very good morning. Welcome to our forum that is organized by University Technical Malaysia Melaka. We are all gathered here to discuss about the interesting topic, which is the roles of occupational safety and health regulations in workplace. First of all, I would like to thank all of you who watching this forum. This is the panels will discuss and talk about today's forum. Let me introduce you to the panels. Panel 1, Dr. Wan Muhammad Syamim Afif, which the Head Department of Occupational Safety and Health in Melaka. And panel 2 is Puan STAZATUL Umirah, which is the Senior Safety Officer in Bumi Jaya Sendirian Berhad, located in Melaka. As all of us know, Department of Occupational Safety and Health, DOSH, is a department under the Ministry of Human Resources, and it is responsible to ensure the safety, health, and welfare of the workers, as well as safety and health hazards in workplace. Dr. Syamim, can you explain what is the sectors or fields that includes in Department Occupational Safety and Health?
Okay, thank you, Mr. Anis. Okay, for the sector that under DOS is 10. Okay, first, manufacturing, meaning of quarrying, construction, hotel and restaurant, agriculture, forestry and fishing, transport, storage and communication, public service and statutory authorities, utilities such as gas, electricity, water and sanitary service. Okay, finance, insurance, real estate and business service. And for the last one is wholesale and retail trader. Okay, so we as a government agency is responsible for all workers in any field that I have mentioned earlier for their safety and health in workplace. Our vision is to become an organization which lead the nation in creating a safe and health work culture that contribute toward enhancing the quality of working life.
Alright, you have mentioned with detail all the sectors that involve and in your responsible. As I concern, there is two acts that in legislations that is crucial and required for all the organizations to follow, which is Factory and Machinery Act 1967 and Occupational Safety and Health 1994. This act is made to protect the workers from all risks that coming from work hazards. My question is, what are the functions for each act that I mentioned before?
Okay, thank you moderator for the question. Okay, yes, each of the act has its own function. First, the Factory and Machinery Act 1957. This act function is to control the factory operation with respect to safety, health and welfare of person and to register and make inspection of the machinery. Okay, it has 15 regulations under this act. This act only cover OSS in manufacturing, meaning quarrying, work of engineering and construction only. Okay, it only cover 24% of the manpower, and the way approach is perspective and inspection by regulation authorities. Okay, for OSHA 1994, the scope is cover all the economic activities and government except armed force and seafarer. Okay, it only cover 19% of the manpower. The objective is to safeguard healthy and welfare of employee and for those who at the workplace, for example visitor or and the contractor. This supported by the code practice guideline and by self-regulation. This approach is to worker cooperation and participation.
Okay, thank you for your explanation, Doctor. I think most of us are getting more knowledge and concerns about what exactly is the function of the Act. As Dr. Shamim explained earlier about the Occupational Safety and Health Act 1994, function is to provide the legislation framework to promote, stimulate, and encourage high standards of safety and health at the workplace. Can you tell us what are the occupational safety and health acts in Malaysia and its salient features?
Okay, sure can. Okay. OSHA 1994 involved the general duties of employee and self-employed, designer, manufacturer, importer, and also supply of plant and or substance. Okay. The salient feature of this act include the establishment of National Council for OSHA and COHS, okay, with the duty to formulate safety and healthy policies, the appointment of safety and health officer in certain class of industry, the establishment of safety and health committee at the workplace, and the use of approved industry of practice as evidence of compliance to safety and health provision.
What are the regulations and what are the regulations and order that made under this act? If you can tell us, Puan Syazzatul.
Okay, there are 10 regulation and orders under this act, okay, which is the first, occupational safety and health for employees safety and health general policy statement, exception regulation in 1995. Okay, occupational safety and health, control of industrial major accident hazard regulation in 1996. Okay, next, occupational safety and health for safety and health committee regulation also in 1996. Okay, occupational safety and health for classification, labeling of safety data sheet of hazardous chemical regulation in 2013. Next, occupational safety and health for safety and health officer regulation in 1997. Occupational safety and health for prohibition of use of substance regulation in 1999. Occupational safety and health for use and standard of exposure of chemicals hazardous to health regulation in 2000. Occupational safety and health in notification of accident, dangerous occurrence, occupational poisoning and occupational disease regulation in 2004. Occupational safety and health for safety and health officer orders in 1997, and the last is occupational safety and health for prohibition of use of substance in orders in 1997.
What are the codes of practice that is state and how many of them in totals?
Okay, it has been listed under four classification, which is chemical management, industry hygiene, occupational health, and transportation. Okay, for chemical management, first, industry code of practice on chemical classification and hazard communication in 2014. Second, industry code of practice on indoor air quality 2010. Okay, for industrial hygiene, industry code of practice for safe working in a confined space 2010. For occupational health, code of practice on prevention and eradication of alcohol and substance abuse in the workplace in 2005. Second, code of practice on prevention and management of HIV/AIDS at the workplace 2001. And lastly, for transportation, code of practice on road transport activity 2010, and the code of practice on safety, healthy and environment for transportation sector SHE code 2010. Uh,
Lines to explaining the requirements so that the organizations will have a platform to see and what to do.
okay, yes, there is a guideline that does provide so that the organization will have a reference. Okay, this is the list of guidelines published by DOSH for agriculture, forestry and fishing. First guideline on occupational safety and health in logging operation in 2004. Guideline on occupational safety and health in fishing of aquaculture operation in 2003. And guideline on occupational safety and health in agriculture in 2002. Okay, for the building, construction and engineering work, the guideline is guideline for approval of design scaffolding in 2016. Guideline for public safety and health and construction site 2007. Guideline for the prevention of fall of workplace 2007. Guideline on trenching for construction safety in 2000. And the guideline on occupational safety and health in tunnel construction in 1998. Okay, for the chemical, is a guideline in mercury management in oil and gas industry in 2011. Second, guideline for the generic use of assessment of health risk arising from the use of chemical hazardous to health in 2006. Guideline in storage of hazardous chemical, a guideline for safe warehousing of packaged hazardous chemical in 2005. Okay, the guideline, the fourth one, the guideline on the use of personal protective equipment against chemical hazard in 2005. The guideline on the monitoring of airborne contaminant for chemical hazardous to health in 2002. Guideline on control chemical hazardous to health in 2001. Guideline for the preparation of chemical register in 2000, and also the assessment of the health risk arising from the use of hazardous chemical in the workplace, second edition in 2000. Okay, and last one for the chemical is guideline on method of sampling and analysis for airborne lead in 1997. Okay, for competency, guideline for certificating of scaffolding operating training center in 2016. Guideline of foreign center for continuous education program in 2011. And also in 2011, guideline for registration of training center for site safety supervisor. Guideline of employee training, registration of training center and operation confined space training course in 2008. Okay, guideline for certificate of crane operator training center in 2004. Guideline for the registration of assessor hygiene technique and occupational health doctor in 2000. Examination syllabus for engineer certificate of competency steam and internal combustion engineer examination in 1996. And last one for the competency, guideline for registration responsible person for tower crane, installer, maintainer, passenger and good housing machine and gondola. Okay, for ergonomic, guideline for occupational vibration, guideline on occupational safety and health for sitting at work in 2003, and also in 2003 guideline on occupational safety and health for working with video. Okay, video display. And last one, guideline on occupational safety and health standard at work in 2002. Okay, for general, guideline on contract management, guideline for the factory and machinery in 2014 and 2015. Guideline inquiry and service industry in 2015. Guideline on occupational safety and health Act 1994 Act 514 in 2009 and 2006. Okay, for the fifth one, guideline on occupational safety and health, notification, accident, dangerous occurrence, occupational poison and occupational disease, regulation 2004 in year 2005. Okay, the sixth one, guideline on occupational safety and health of service sector in 2004. Guideline on gender issue on occupational safety and health in 2003. Guideline of for medias professional in 2000. Guideline on occupational safety and health in office 1996. Guideline for the protection of employee against the effect has workplace And the last one is guidelines on occupational safety and health management system. Okay, for HIRAT, guideline for hazard indication, risk assessment and risk control in year 2008. Okay, for industry hygiene, guideline on heat stress management at workplace in 2016. Guideline on occupational safety and health for design, inspection, testing and examination of local exhaust ventilation system in 2008. And last one for industry hygiene is guideline for control occupational noise in 2005. For this occupational health, a guideline on Aedes mosquito control in construction site in 2015. Guideline on occupational health service 2005. Guideline of preventing responsible to drug and alcohol problem in workplace in year 2004. Guideline on first aid in the workplace, second edition in 2004 also. Guideline on reproductive healthy policy program at the workplace in 2002. Guideline on medical surveillance, and last one is guideline for the prevention of stress and violence at the workplace in 2001.
To make sure all of these acts are going smoothly, there must be a good management. If you can explain to us, Puan Syazatul, what is occupational safety and health management?
Okay, occupational safety and health management system function is more than just a workers safety and health, but it is include the health and safety policies, system, standards, and records also involved in cooperating the health and safety activities and programs into the other business processes.
Studies shows that the good occupational safety and health management in a business has relationship with the improvement of performance and profitability. Is it true that the good occupational safety and health is good for business?
A company with a poor safety and health in workplace using resources dealing with the company benefit, such as productivity through less sickness, absence, or medical certificate later. Second, cutting healthcare costs. Third, keeping older workers in employment. Fourth, stimulating more efficiency, working method and technologies, and also the last, reduce the number of people who have to cut their hours to care for a family members. Okay, let's study about the other Europe countries that every euro invest in in occupational safety and health. There is a return of 2.2 euros, and that is the cost benefit ratio of improving safety and health is favorable. Okay, also they have bring benefit for the business. Business company with a higher safety and health standard likely more successful and more sustainable. The advantage is they can improve the workers' productivity, cuts down, reduce compensation payments, and meet the requirements of public and private sector contractors.
Is there any key elements of a safety and health management, Dr. Syamim?
Okay, there are key elements of good and success safety and healthy management system, which is policy and commitment planning, implementation and operation, measuring the performance, and also auditing and reviewing the performance.
Okay, Puan Syazatul, can you tell us what is the functions of occupational safety and health management?
Okay, of course. Okay, the main functions of the occupational safety and health management is to increase the effective of ocean management, to guarantee compliance with existing legislation, and to improve the a shared performance. There are few main factors for the management to success or failure. The things that contribute to a success is strong senior management commitment, management living up to its message, a stable organization with a stable workforce, provision of adequate resources, and more. But the vice of this matter will for operational and
If we
health
want to have
management.
a better skills and good knowledge, the training is required so that the workers have an idea on how it works and how it runs. Is there any legal requirements for appropriate safety and health training to be given?
Okay, OSHA, for reference, OSHA in 1994 requires everyone, including every employer, to provide any training, equipment, uh, personal PPE, which is personal protective equipment, and all the information that is necessary to ensure the safety and health of the workers.
Is there any consequences of not having a training? Is it affect someone's safety and health?
Okay, there will be an effect to safety and health. Is it because a non-trained employee are likely to make a bad job performance and increase the work-related stress? The chance of the organization to lose an employee will increase if the workers are feeling unhappy and feel they have no value. So it is crucial and important for everyone to have a training and they have a clear path on what are they doing.
Okay, what are the reasons for implementing an occupational safety and health management system? Because this is important as everyone wants to know what are the effect by doing this.
Okay, everything that is state and conduct in law has its own reason. Okay, for this management system, the reason to implement is to systemize or management to optimize prevention so that the worker will more alert and to reduce the possible future liabilities and many more reasons, but this is a few of them.
Okay, for the last questions for this forum, before we ended it, Syamim, can you explain what is the impact of occupational safety and health management on occupational safety and health performance?
Okay, they have many impacts and influence of occupational safety and health management. Okay, to the performance in organization. The management system will one function perfectly when there is a continuous and systematic control of all the activity and influence that are relevant to occupational safety and health. There are issues whether the management have a positive effect on health and safety or not. Some say that components almost take it all for granted that an management system will automatically lead to a better health and safety performance as suggested in OSHA standard. Others say that it scam, fraud and burglary to describe the management system and pointed out the workers lose their influence. In reality, the impact of occupational safety and health management system is depend on several contextual factors and therefore ambiguous.
Okay, we have discussed a lot about the role of occupational safety and health 1994 and the occupational safety and health system management also. So we can conclude that it is important to all the company to follow the rules as it is already been given in Department of Occupational Safety and Health. There is so much role that the acts that influence the companies. I hope that this forum will bring more input to the audience, and thank you to the panels for coming and share this information talk. Until we meet again in the next forums. Thank you and Assalamualaikum.
Waalaikumsalam.
Welcome.